Is the bottom number of your blood pressure reading high? The bottom number of the blood pressure reading, known as the diastolic blood pressure, can change independently of the upper number or the systolic blood pressure. The top number or the systolic blood pressure is a reading of the blood pressure while the heart is contracting. The lower number or the diastolic blood pressure is a reading of the blood pressure while the heart is relaxed. The diastolic or lower number tends to rise gradually until age 55. After that, it decreases gradually. Now, it is clear that high systolic blood pressure is associated with heart disease and strokes. And studies have shown that high diastolic blood pressure is associated with heart disease, heart failure, atrial fibrillation, and chronic kidney disease. The 2017 ACC/AHA guidelines for blood pressure recommend either lifestyle changes or medication for persons with diabetes, heart disease, chronic kidney disease, or a 10-year heart disease risk of 10% or more. A normal diastolic blood pressure is defined as a blood pressure of 80 millimeters of mercury or lower. If the diastolic blood pressure is higher than 80 millimeters of mercury, that is considered diastolic hypertension. If the systolic blood pressure, the upper number, is lower than 130, and the diastolic blood pressure, the lower number, is higher than 80, that is called isolated diastolic hypertension. But the diastolic blood pressure and the systolic blood pressure can both be high at the same time. In fact, that is the most common scenario. Isolated diastolic hypertension tends to occur more frequently in younger individuals below the age of 40. So how do we lower the diastolic blood pressure? Like in every type of hypertension, lifestyle changes can lower the diastolic blood pressure. Aerobic exercise and qigong and smoking cessation and weight loss and decreased alcohol intake can all lower the diastolic blood pressure. When lifestyle changes by themselves are not effective at lowering the diastolic blood pressure, we can turn to certain medications. For example, ACE inhibitors, or ARBs, or angiotensin receptor blockers, calcium channel blockers, or water pills. These can all lower the diastolic blood pressure. The newer class of diabetic medications, known as SGLT2 inhibitors, can also lower the diastolic blood pressure. In treating diastolic hypertension, we have to be mindful of the fact that a diastolic blood pressure of 70 to 80 millimeters of mercury was associated with the lowest incidence of heart disease and strokes. Lowering the diastolic blood pressure to lower than 70 millimeters of mercury was associated with a higher incidence of heart disease, especially in older individuals who have poor circulation to the heart. I hope you found this information useful. If you did, like and share the video with your friends and family. You can support the channel by subscribing. Until the next video, stay healthy and stay safe.